Hi everyone, nice to connect with you all again. This is Giri Srinivasan, registered physical therapist from Ask Giri, the Physio Show. I just came back from a wonderful 20 days cricket tour to Ireland and Wales. What a wonderful, beautiful country, beautiful, wonderful people, very hospitable, very friendly. Me and my friends from the team really enjoyed that trip. So I'm back from the trip, back to the grind, and I'm here to connect with you all again. Today's topic is neck. We're going to talk about neck. Cervicogenic, that means origin from the neck. We're going to talk about cervicogenic headaches and dizziness. We all know we abuse our neck so much with the modern world electronics, our iPhones and Samsung phones and tablets and everything in our, what we do is in front of us. We use a lot of our neck and we abuse it quite a bit. There are so many names, text neck, this neck, that neck and everything. This episode is to how to actively manage these neck issues. And sometimes you can have neck issues shooting the pain into the back of the head as headaches, and also sometimes it can cause also dizziness. Not all dizziness comes from your inner ear, okay? About 80% of the people who come to me for vertigo dizziness issues are basically diagnosed as dizziness coming from the neck. That's called cervicogenic dizziness. We work on the neck, make things move better, your joints and your muscles, your fascia, teach you a couple of exercises to work on that area and proper ergonomics and how to take care of the neck. Then you are dizziness free, headaches free. So a lot of people are still living with this headaches and dizziness without knowing. Working on the neck, for in 2-3 weeks, you can get superb results for your neck pain, headaches and dizziness. So I'm just showing you some of the pictures here to appreciate. Look at how many muscles we have in front of the neck, on the side of the neck and back of the neck. There are so many muscles here. Are we actually using all these muscles regularly, properly? Are we overloading some of these muscles and not utilizing some of the muscles? And look at these joints, beautiful joints on the vertebrae. Are we using these joints in the full range of motion? How many times do you actually look up in a given day? I know a lot of people don't even look up even once a day, but we have so many joints and muscles to do the work. So these are the main reasons. Okay, you do overloading or underloading that area, you have weak muscles, you put so much postural stress and repetitive stress in the neck, and a lot of people work out hard in the gym in the summertime and straining the neck for the shoulder exercises, right? We see them so much, and all these things can cause irritating the nerves, and they also cause some issues with your connection, your circuit between your upper neck, your eyes and the brain, and that circuit issue can cause you dizziness as well. So here I'm going to show you with my assistant Kyla some of the ways to manage these issues. But this is not a replacement for any medical advice or physiotherapist consultation or healthcare professional advice. This is some self-help tips, that's all. But if you need more, please contact a physiotherapist or healthcare practitioner to get more better results for your neck issues. How do you manage your neck when you have so much pain, headaches and dizziness coming from the neck? There's a lot of things you can do by yourself to take care of your neck, because neck is being abused every single day, because everything what we do in our life is in front of us. You're using your neck so much, whether you're using a phone or a laptop or desktop or all the work we do. The first thing you can do is make sure you're moving the joints of the neck in all directions completely. Okay, so here I have Kyla, my wonderful assistant. She's going to be my model today to show you some of those things. First thing is looking up the ceiling. Kyla, I want you to look up all the way. Take your nose parallel to the ceiling. Ask yourself, when is the last time you looked up like this? I'm sure it's not anytime soon. Come back down. Chin all the way down to the chest. Very good. Then come back up. That's your flexion extension, just a range of motion, nice and gentle movement. Then we're gonna rotate all the way, take your chin over the shoulder, nice and gentle. You can have a gentle push if you can't go. None of this exercise should cause you more pain, okay? Now go to the other side all the way. Wonderful, give a gentle extra push there, very good. Come back to neutral. That's a rotation. Now we're gonna do some side flexion, going all the way to this side and then going all the way to the other side. This is basically some neck range of motion to improve the joint mobility. This is not a stretch again. Then you also want to move your head a little bit diagonally too, right? I would like you to move diagonally. You're looking up like that. A beautiful bird on the tree. Come back. Oh, there's a nice apple on the tree on this side. Wow, look at that. Right? And then come back. So this kind of diagonal movements also really helpful, okay? Play with it, then your neck joints will be very happy. You're lubricating the joints, getting nice nutrition to the joint. This you can do within your pain limits. And if you have lots of pain or dysfunction or any dizziness when you do that, consult your physiotherapist or healthcare professional for further advice. 2 or 3 good stretches for your neck we're going to show now, okay? Number 1, because you always bend forward, the front of the neck is always in a shortened position. There's a lot of muscles in the front of the neck, and you can also see the picture of the front of the neck anatomy to see how many muscles are in the front of the neck, in also along with the fascia connecting from the mandible, your jaw, to the chest bone. To stretch the front of the neck, all you have to do is just look up and put your hand on the chest for me, Kayla. So stabilize that your chest bone and then just feel that stretch in all the muscles here and all the way up to your chest bone. Can you feel that, Kayla? Yeah. And nice breathing with it. In through your nose, out through your mouth. Beautiful. It feels nice expansion here. And then come back. Just hold it for about 20-30 seconds and then relax. That's for the front of the neck. The next muscle group you want to stretch is your trapezius, especially the upper trapezius, which is right here. Everybody carries the tension in those muscles and it can be really tight for some time. So to stretch that, basically you're going to depress your shoulder girdle. Can you sit on your hand for me? So when you sit on the hand, you're kind of depressing the shoulder girdle, fixing this point here because your trapezius kind of in that area, right? Now we're going to take the head away from that shoulder. Can you use your other hand there? And gently you're going to hold it there. You see this whole upper trapezius being stretched here. And that's exactly the stretch we want. Don't be too hard on yourself. Nice and gentle. Incorporate breathing with it. In through your nose, out through your mouth, and then just relax after that. And we're going to obviously try on both sides. Can you do the other side? Sit on your other hand. Hold it there. Beautiful. Nice and hold it for 20-30 seconds. Try to do 2 or 3. You can do this even when you're working with the desk also, right? In your laptop things, take a small break, a movement break, and then do this in between. Good. Thank you, Kayla. Okay, the next muscle I want you to focus on is the levator scapulae. So that's a muscle which is coming from almost at the top of the head here. It goes like that and attaches to the top of your shoulder blade right here, okay? And that muscle can be very tight most of the time. So now Kayla is going to show you the stretch for that muscle. Okay, first you're going to bend your neck all the way down, okay? Then you're going to look into your right armpit. Right now we are stretching the left levator scapulae, and keep your hand up there and pull it gently towards armpit, okay, with a good breathing. So that's a stretch. Can you feel that stretch, Kayla? And that's a stretch for the levator scapulae and the muscle you see in the picture where the muscle is. And obviously you're going to do it on both sides, and you're going to hold for 20-30 seconds, do 2 or 3 reps in your movement break during your desk job or during any kind of work you do. Beautiful. Thank you, Kayla. As you know, there is a whole bunch of muscles in the neck, in the front, in the side, in the back. To strengthen those things, there are simple things you can do to strengthen those neck muscles. We're going to see some progressions too, starting with isometric work. Then we're going to use some resistant band. Then we're going to do a specialized equipment called the iron neck. That joined our exercise equipment list now. That's a beautiful equipment there to strengthen the neck muscles, especially for the sports and athletic population, and also for the general population, whoever wants to have a very strong neck. A lot of NFL players and NHL players and athletes use that to have a very strong neck. So the progression from the isometrics we did with the self-resistance is using a band. So she's pulling the band and try to pull the head backwards against the resistance of the band, and a little bit of movement is there too. Okay. So this is the next level you can use other than the resistance too. And you can come to the side now, you can go to the side. Yeah. And then you can go that way and pull the band this way. Now you're working that too a little bit more than the self-resistance. You can relax now. So this is another thing you can use here. You can use either the band, even if you don't have a band, you can also use a towel if you want to. This particular exercise is for the deep neck flexor muscles, which is really in the deep area of your neck. We can call it even the core muscles of the neck. A lot of people think core is only in the abdomen area. No, core is all along the spine. So this exercise can be done very effectively in lying position. Lying on your back like this, nice and relaxed one, good breathing. Then what you have to do is tuck your chin down and you maybe put one finger over there, Kayla, and keep maintaining that chin tuck, okay? Then lift your head just off the bed. That's it, not too much, just off the bed or the floor, and hold it there for a good 10 seconds with good breathing. We call it a chin tuck lift. That's exactly, you're actually lifting the weight of the head against the gravity. So that's the resistance you have. It's a great exercise. Start with a 10-second hold and maybe go up to 20, 30, 40, even go up to 60 seconds if you can. And if you have any pain, stop and consult your healthcare practitioner regarding this one. And that's your deep neck flexor firing exercise. So now we're going to talk about some soft tissue mobilization of your neck, especially the suboccipital muscles, the muscles just below your scalp and on the top of the neck. How to gently release that. You have to do this very gently. Don't go overboard on it, and don't take your foam roller or a Theragun into that area. Nice, a little tennis ball or lacrosse ball. Just put it underneath that suboccipital muscles under the scalp, and you can see that there, and gently work on it. Move your head just back and forth, nice and gentle, very small movement, and then up and down, very small area. Then keep changing the position to the middle, to the other side as well. So this is your soft tissue release using a ball in that area, nice and gentle. So this equipment, it's called iron neck. This is mainly for strengthening the neck muscles in different directions with different resistance and with different movement patterns. Kaila's here to demonstrate some of from the simple ones to the hard ones. Okay, Kaila, let's start. She's working on extension now. She's pulling that way and then working against the resistance. I can increase this resistance here also. And also I can increase the resistance by changing that strap also. The strap what she's using is about 10-pound resistance. We have strap with 5 pounds and 20 pounds also, depends on what she's doing. Now she's doing some rotation movements there. Yeah, and come across a little bit more. The more you go away from it, obviously you're going to get more resistance. And she's working on the rotational pattern now. For the neck muscle she's working, I can feel that neck muscles working everywhere here against this resistance. You do that and do some side flexion now, Kaila. Yeah, this way and that way too. Yeah, there you go. Side flexion. Wonderful. Okay, now showing different forms, doing on a lunge or the squat forms. So we can also modify the leg work. You can go to a lunge position and work on the neck, and also you can use your upper limb too. Yeah. And then you can do in squat positions. Yeah, squat positions, you can incorporate that, free hands, or also you can use the medicine ball in the hand. She's right now on the ground. You can do this exercise on the Therafoam or on the Bosu ball. We can increase the complexity so much in so many different ways, and we love this equipment. Our patients love this, especially after motor vehicle accidents. You're in the later stage of rehabilitation to strengthen your neck muscles after the whiplash injury. It's a great tool. Sports injuries, athletic injuries, rugby, hockey, anything you need, and soccer. And if you want to have a strong neck, this is a great tool and great exercise to use. Yeah, I don't mind having an iron neck. So the process begins now. I'm going to do some iron neck training for my cricket and also for my golf. Hopefully you learned 1 or 2 new things which you didn't know before. If this is helpful, please like and subscribe Physio Show, Ask Giri Physio Show in YouTube. Also go check out the website physioshow.ca, and there is tons of contents there for you to educate yourself and empower yourself. Okay, good luck.